Hi, I am the educational consultant for advanced clinical documentation for nurses and other clinicians, and I have the pleasure of speaking with Miss Brianna today. And Miss Brianna, if you don't mind, would you just let us know, just as brief as you can, just your background in nursing?
Okay, absolutely. Thank you for having me, first of all. And to briefly put it, my background is primarily in community health. So my first job was in a federally qualified health center, or an FQHC. And after the FQHC, I went to the hospital to get the acute care experience as a nurse. Didn't stay in acute care for too long. I knew that I didn't want to be there for a period of time. So shortly after, I did go back to community health, not an FQHC, but the local public health departments. So most of my nursing background is med surg and community health.
Nice, nice. So I am familiar with FQHCs.
Okay.
I actually worked at one some time ago because as I can see from your credentials, you have a case management credential.
Uh-huh.
And yeah, I worked in a capacity similar. So I'm familiar with those facility types.
Okay.
So, so just give me, if you can, what led you to nursing informatics? And I'm only saying this because I find that always surprised actually by the different pathways in which I feel like people experience or exposed to nursing informatics. But
Yeah.
yours by far is probably the most textbook one where you kind of really knew what how should I say your introduction to nursing informatics, it seems like it came from your learning experience. It didn't come from you um uh like stumbling on it. It didn't, you didn't see like there wasn't like a special speaker that came. It's like you actually experienced it through your learning experience, like through your nursing school curriculum, correct?
Yeah. So what led me to it was, well, I did know a little bit about informatics. It was the one of the later courses, like I believe my senior year in nursing school, but it was very brief. It wasn't as in depth as all the other classes, right? Because in nursing, we were more so taught to be clinical and patient centered, not really technology. So I knew that that course was really interesting to me, and I really don't even think that I fully understood it then. Um, but what really led me to it, outside of just like that, oh, informatics is such a thing, um, was the experience at the FQHC and then the pursuit of my case management certification. Um, at the FQHC, I really liked the job that I had there. I liked being part of the change management um, and the workflow. So my role was to oversee like the clinical aspect from the time that the patient came and left. And I worked with medical assistants. So like we were a team, and part of what I had to oversee was like, okay, we got to make sure this patient gets in and gets out, but all their needs are met. We have to make sure that we're documenting correctly. Um, Make sure that when we get the vaccines, we're storing it appropriately, we're logging the temperatures. So part of it was administrative, but it was still workflow. Um, so I liked certain aspects of that role. I didn't really like being in charge, because in that role I was in charge, in a little bit in charge, because part of my role was also doing what the medical assistants did, but also heading our small team at that FQHC.
Mhm.
So I didn't really like the like decision making part of it, but I really liked being part of the decision making when it came to workflow, quality, and change management. I didn't know that that was informatics. I didn't know that that was really that realm of practice. And then when I decided to pursue my case management, certification. The book that gave me a broad perspective on healthcare, how it works, insurance, and the quality that case managers have to pay attention to when it comes to addressing the patient holistically, I was interested in that part. So I feel like somewhere along the line, maybe in the back of my head, I knew it was informatics, but I really didn't because I knew that I liked informatics, but I saw them as separate things. So yeah, that's how I sort of stumbled into it. And it wasn't until what I call my truest job experience, I think that was really informatics related, was when COVID happened. I had an opportunity to be like a public health liaison. So I was part of a workers' comp team. The workers' comp team, anytime someone in the workplace tested positive for COVID, we had to call the patient, do like a risk assessment, do a small, why can I forget the word? Why am I forgetting the word? Do a small, when you have to see the,
Are you referring to making like a referral to their providers?
No, I'm referring to if I gave somebody else COVID, you have to do the tracking.
Yes. So let me give you. So I'll give you a brief description of something similar.
Okay.
So during the COVID, I would say maybe 2 or 3 months after we went into quarantine. I was actually a clinical consultation nurse, and I actually did that same kind of work where it was workers' compensation for COVID for employees that were exposed to the virus, and essentially it was following at the time it was a very evolving CDC guideline around who should quarantine, how long they should quarantine, when you can come out of isolation, who who in your family or what kind of time distance of of exposure would be
Yes.
acceptable, and it was
That,
chaotic.
yes.
So I know exactly what you're talking about. It is one of those type of experiences that I could see why you were very careful in choosing your wording, because it's one of those things where you had to kind of be there to know what it's like. So
Yes.
I have a lot of respect for you because I was doing that and I was like, you know what? This is good
Mm,
experience because it was a public emergency,
yeah.
national, international emergency. I get it,
Yeah.
but I feel you. So
Yeah.
please, so
Yeah.
you said you were doing the consultation for the COVID positive for workers' compensation. Now, was this an insurance company you were working for at the time?
No, this wasn't an insurance company. This was actually it was a contractor who was contracted with the actual workplace setting.
Okay. So more like occupational health, kind of that public
Yeah,
health, occupational health. Okay. All
correct.
right.
Yeah. And so
Okay.
our branch wasn't technically workers' comp, but we were like a subset of the
Mm-hmm.
workers' comp team. So
Understood.
that contact investigation,
Mm-hmm.
that contact investigation piece, um, my role was to not only did I do the exact same things that you did, I
Mm-hmm.
also had to extract the data from the system and then clean the data and then report it to the different states that workplace was in. So I got to see the dashboard that they created from the electronic health record. We could actively see the number of people who tested positive at different places, just lots of information. And that was like, that is what I want to do. I want to be a part of
Yes.
that. Yeah. So yeah,
I feel you. I feel you.
community health, data, just somewhere in there.
And I think the interesting thing about that is most nurses, if you're working case management and you're thinking about it, or you're considering working in case management and you're thinking about it like home care, because there's a home care aspect to it. If you're working for a home care agency doing case management, yes. But it doesn't matter. Case management whether it's home care and it's very touchy feely with the patient, or if it's a remote virtual kind of case management. At the end of the day, it's a lot of data management. You see a lot, you're exposed to a lot of that. And I encourage nurses to actually look at those as opportunities, just like what you got to see, like see where the information goes after it's being gathered. But I think that's really, really cool that you actually got to clean it, because that is such an intricate part of data analytics, that cleaning piece,
Mm-hmm.
that data, like governance, managing that data. That's a big, big, big thing. So,
Yeah.
so please, I would just like to know, what skills would you suggest or recommend a nurse who's interested in informatics to pursue, to obtain, to uh, focus on building up or developing in within their professional practice, or their experiences every day as a nurse, if they're interested in going into nursing informatics?
Okay. So I'm going to echo something you said a little bit earlier. First of all, I really do think that as nurses, we already have the skills, right? I
Mhm.
feel like we were trained to be skilled. We were trained clinically. We're patient centered, um, you know, clinical, nurse care plan, all that stuff. So we have the skills. And I think we have the skills not only to transition to nursing informatics, but anywhere. But I think that what we need is like the knowledge about how healthcare works. We know how healthcare works from the nursing perspective and how we interact with the physician and the nurse team as a whole, but not like, coming from bedside. Before we get to advanced nursing, we don't know like maybe what someone who went to school for healthcare administration would know, or some of the other degrees, because we're nursing. So to take for you to go from bedside to nursing informatics, you said pay attention to where the data that you input goes after. So I think that nurses need to just acquire some knowledge in general, maybe about how healthcare works, at least starting specifically with the specialty that they're in, um, and the data that they use, the people that they interact with. Like, how does everything work afterwards? What is it that I'm doing that's part of the decisions that we make to all together? Like, what do I have to do and what is important to what I do that then makes decisions later? So being willing to ask questions about how stuff works, how, what I've done interacts with the big picture. Does that make sense?
Oh, listen,
Okay.
I'll tell you this
Yeah.
briefly. Went back to school to get my master's in nursing education. As I was going towards the tail end of that, I said, wow, I really wish I would have went informatics, right? I just remember I just kept saying that to myself, because I know I'm more of an analytical person, and I really never at any point in time loved anything about bedside nursing. When I was in nursing school, I dreaded even going to clinicals. That was just not my thing. I was doing case management prior to becoming a nurse. So in my mind, I just wanted to continue to do case management. So I was doing case management from like a social work, that kind of perspective. So I just wanted to continue to do case management.
Yeah.
So honestly, when I went back to school and got my master's in nursing education, I thought to myself, why did I do this again? Why did I put myself yet in a situation where I'm not just saying, okay, I want to learn, go more deeper into technology? Why did I just go that route? But I actually had some work published through the university when I was there. So I kind of look at it as kind of maybe God's will, right? That's
Mm-hmm.
just what God wanted for me. But the reason why I was saying that is, I feel like what happens oftentimes with nurses, found myself going back after my master's to get my certification in risk adjustment, because essentially my goal was really to, like you said, track that data. I was able to see what was happening with chronic conditions and how insurance companies pay for that, and how they figure out and factor out predictions, and how much it costs to manage certain diseases. How do they predict payment for services, right? Payment
Mm.
for certain diseases, payment for certain conditions that their members have. Because with insurance plans, they're more so concerned about population, right? The population and the needs of their members, and how they function as a business is very much on how they manage that data. And
Yeah.
so again, going to what you were saying about being curious about what happens to that information afterwards. You gotta want to know. If you're
Yeah.
collecting someone's blood pressure, someone's blood sugar, that may seem like a really mindless exercise for you. As far as the healthcare effectiveness data information set, HEDIS, right?
Yeah.
Um, it's like, yeah, that blood sugar means the world to that insurance company.
Mhm.
That those blood pressures being checked for that person with that cardiac issue. All of those things are so important when you're
Mhm.
talking about what happens after the information is input into system. So what you said was dead on. Like, I
Yeah.
completely and totally get it. You have to be curious about what happens to information after you collect it. I think,
Absolutely.
unfortunately, nursing education kind of teaches nurses to kind of keep their head down and just work.
Hmm.
And sometimes we are not as curious as we should be. Interestingly enough, you need tons of curiosity and critical thinking for you to pass your boards. But then it's like you go and take your nursing role, and all of a sudden you just take your thinking cap off, and it's just do, task, task, task. So I
Yeah. Yeah.
completely, totally get you. So
Hmm.
as we are getting towards the end of this chat,
Hmm.
um, I just want to ask you a question. So, as far as what you're doing now, are you providing any services for nurses now, or is there a way nurses can get in contact with you if they want to learn about nursing informatics, or get mentorship or support? Are you offering any services like that right now?
Yeah. Um, so I'm not a nursing I'm not a nurse informaticist of 20 years experience, that I would say that I offer mentorship.
Hmm.
Um, but my YouTube channel is the path through which I'm documenting my experience and my passion in the field. Aside from nursing informatics, I am building a small business, or I have a small business. It's a nurse recruiting agency. Um, Part of that nurse recruiting agency stems from my experience in trying to really piece together what it is I like to do, having found that and wanting to help others to do the same. So underneath the umbrella of that nursing agency, I do offer, resume updates, resume consultation. Um, I don't. There's a fee for that, but I don't. I don't charge a fee for the beyond the bedside conversation, because part of being a recruiter is connecting and networking with people. Not only do I want to do that, I want to communicate with more people who are of a like mindset as me. So I want to connect with nurses who are interested in using their clinical skills in nursing informatics or just in non-traditional areas. Um, so that's the beyond the bedside conversation, or beyond the bedside consultation, which is free, which is, just to connect with me. I do have a free resume download. So that's a template. That is actually my resume that I worked so hard on over the last few years through my experience trying to really take my bedside experience, take my clinical hands-on experience, and translate it into presenting the skills and the desire that I have that would be relevant to the nursing informatics specialty in general. So that is a free resume template. A lot of people have given me really good feedback. They've enjoyed that. Again, a resume is not going to be like, oh, now I have this resume and I'm going to get all these jobs and this is what I need. Like, my resume template is not a guarantee of that, but it is absolutely something that I think is going to be a great resource for people who are trying to kind of understand how to tailor their experience, maybe even how to organize it. Surprisingly, you know, a lot of people are, well, you'd be surprised that not a lot of people are very good at putting their resume together. And, you know, it could be something simple, but it actually really isn't, especially when not just transitioning from nursing to informatics, but transitioning from one job type or one specific practice to another, right? If I'm a tech trying to go into nursing or nursing trying to go to tech, like your resume has to look completely different so that people can look at you, look at your resume and even consider it, right? So it can go through the ATS system, so it can get somewhere for you to even get a call back. So resume, marketing yourself, that is what I'm here for. That is what I enjoy doing. My services.
Well, I want to tell you thank you so much because what you said about resume, review, resume assistance, that is so important because of what you just mentioned. Now
Yeah.
you have to teach people, guide people, support people, help individuals who are interested in transitioning. I've been in this situation more than I'd like, who are really struggling with putting their words together and showing that, you know, some of those skills that they may look at as just like, oh, these are soft skills. They can't be used if I want to transition into a more technical role, but actually they're very much needed. Your clinical skills, your passion and compassion as a nurse is still going to be very much needed, even if you're working virtually or you're working remotely or you're not physically touching patients. That patient information does impact patient care and the quality of care that's being delivered, especially to vulnerable populations. And what you said about resume is so spot on because
Mhm.
if you're not able to use the right language, if you don't understand that like an industry outside of bedside nursing, I think that's where people struggle the most because
Yeah.
then it's like, okay, like, yeah, I know I'm comfortable with EHRs. I like EHRs, but it's like, have you ever considered that when you rewrote that, that charting template, did you consider that that was something that was also very much in the informatics space? Like, did you think about the fact that you were communicating across many different disciplines with just a single template design? Many nurses have that kind of creativity and they don't apply it to something technical per se because they're
Yeah.
not looking at it as being something related to technology because they know nothing about that space. It's just, it's almost like stepping into a new world. I know for me, when I transitioned from kind of doing that case management that was like really hands on, and I started to go more to like the data management side, and especially when I became certified in risk adjustment, that just learning about clinical documentation improvement altogether. It was
Hmm.
one of those things where I started to see the healthcare system as a business.
Yeah.
As a nurse, I looked at it like I was just one of the soldiers on the front line. When I started to learn about learn about it as a business, then I'm like, oh, okay. That's when it helped me understand that I needed to be in a leadership position. I
Yeah.
never,
I love
yeah,
that
yeah,
perspective.
yeah.
I love
So
that perspective. Hmm.
I
Go on.
appreciate it. No, I just want to say, I listen. You struck a chord with me just a while. So
Okay.
that's you got me going.
Yeah.
So I want
Yeah.
to thank you so much for your time.
Mhm.
And I just want to ask you to leave some parting words for the audience. Anything that you would say as a word of encouragement to any nurse who just kind of feeling downtrodden. Maybe they feel like they want to transition, they're kind of afraid. Um, I'm just anything, Brianna. I study your stuff, so because I'm a student of your content,
Oh,
I know
okay.
you have
Okay.
something encouraging to say.
Wow. Wow. I feel
Yes.
so honored. Like, you know, I'm recording these videos and I'm like, you know, sometimes you just feel like you're saying a bunch of stuff and you're not even sure if anyone's listening or if they care, but because it's something that you like to talk about, you just do it anyway. So
Of course.
I'm really happy, you know, to have like struck a chord and made that connection with you. So Again, I appreciate the connection that we've had here today. And as far as what I want to say, and I wrote notes so I wouldn't forget what I wanted to say, but I would like to say that for anyone who doesn't know what the heck to do to get into informatics, like, because I felt like it was never going to happen for me. I didn't know I was doing it the whole time, but I was just, I was struggling because I knew where I wanted to be. I didn't know what it was, and I was upset about it. So I would say that you have to be open to accepting jobs where you might get paid a little bit less. If things are not opening up for you, because bedside money is really good. But then when I had to transition or decided to transition like into community health or outpatient and was making a little bit less, I didn't have differential and all of that. I wasn't super excited about it. But if it wasn't for that flexibility, being willing to like step down and accept that, this is not the traditional nursing, this is not the traditional money, but it was worth my everything. It was worth my future experience. It was worth my, what was inside of me that needed to experience what I needed to share in the nursing field. It was worth it. So I would say be open to the flexibility and the possible pay cut with different jobs to get you where you want to go. And then the other one was not to be afraid to tell people what you're really interested in doing. So on your current job, it's not like you're going to say, I don't want to do my job. Like, you're here to do A, B, C, and D. You can still do A, B, C, and D, but don't be afraid to let people know that, you'd also be willing to do this. I mean, I don't want to really do a bunch of stuff that's not in my job description and not be paid for it, but I still want to take what I need for the next thing. So I won't be able to do that if I'm not expressing my interest in certain things, if I'm not connecting with people, whether that's on my current job or like, people I come across with on the street, in the store, at church, wherever. Just like, don't be afraid to like talk out loud what it is you want to do. Even if you're not doing it and you're not where you want to be. There's these YouTube videos I see where it's like, oh, shh, don't tell people your plans. Don't tell people what you're doing. Yes, to a certain extent. Like, you're not going to get to where you need to be if you don't start talking and opening your mouth. So, yep, that's all I have to say.
Well, thank you so much for your time. I'm looking forward for us to connect again. I actually had the pleasure of recently sitting down and talking with Computers and Coin.
Okay.
Yes, and that was a lovely chat, just as
Yeah.
lovely as this chat is tonight. I want to thank you for taking the time to speak with me and my audience. I wish you the very best, and I'm looking for another opportunity for us to chat in the new year. So I wish you the very best for the holidays and a happy new year.
Thank you so much.
Yes.
We'll chat soon.